Hello everyone, my name is Vinny Trivedi Gopinathan. I'm the founder of PlayStreet, Bangalore, India. I'm an RDI consultant, OPT and a feeding therapist, an AEC program co-creator called the Play Talk program, and an Access Bars facilitator. PlayStreet is an organization that provides educational services to help the child with special needs become independent and live up to their potential. We offer parent empowerment programs and integrated schooling programs and a variety of clinical services. As April is Autism Awareness and Acceptance Month, we wanted to bring to you the pioneers in the field of autism to guide us all and spread more awareness and knowledge. Today is our 19th talk, and our unconventional speaker for today is Dr. Ashwani Garg.
Thank you so much, Minnie, for inviting me and giving this opportunity so that I can share something relevant for people and parents who have this issue with their kids.
Dr. Ashwani Garg is a conventionally trained medical doctor with a certification in functional medicine. For the last few years, he has been practicing functional medicine. Functional medicine is a systems biology approach focused on finding and solving the root cause of chronic disease. Just like for every other chronic disease, there are various underlying causes. Similarly, autism and ADHD has multiple underlying biological causes too. Dr. Ashwani Garg and his team focus on delineating the root cause of learning disorders in children, helps them with a sustainable solution. Today, we are going to talk about functional medicine for children with autism. Welcome, Dr. Ashwani. And I will start with a very basic question first. What is functional medicine and how is it different from conventional medicine?
All right, that's a good question. And I think it'll help parents to understand a little bit about what we are doing. Conventional medicine is largely an approach based on the diagnosis or organ-specific or disease-specific treatment. For example, autism, ADHD, they're considered as brain disorders. And the whole treatment is focused around that one body part. But in practicality, there's a lot of other things which are going wrong in the body, which are impacting the brain to have such condition. It's not a starting point is not in the brain. Okay, so functional medicine is wherein we try to break the problem in separate problems. Then start one by one. What are the different issues behind each of the symptom or a sign or a diagnosis the patient is going through, and start solving it. So it's all about getting to know what has caused the problem in the first place, and step by step, by breaking the problem down, we start resolving them.
So why should we choose functional medicine when we have so many other options to choose from? What are you providing those other disciplines are failing to provide us with?
Right, it's a good question. So today people have homeopathy, Ayurveda, naturopathy, and of course conventional medicine. So in functional medicine, we use the top-notch technologies or diagnostics to get to the root cause. Now, for example, most of the Ayurvedic guys or most of the homeopathy, these are great line of therapies, but they don't use the most sophisticated technology that are available to a clinician. So I can get down what has happened, what has caused the biochemical imbalance in the child. Okay, so naturopathy also, homeopathy also, they are holistic approaches, but again, they don't use the latest thing, which is we as a functional medicine, we get into use of that, and we can make a very, very personalized treatment plan for each child. Not that, we are shooting in the dark. We figure out, is it an infection? Is it a deficiency? Is it a toxicity? Is it a organ dysfunction? Is it a microbiota disbalance? Whatever it is, we test it. And second part, what I realize is if I tell the parent without telling them the cause of the problem, I tell them do these 10 things or 15 things. Parents are always confused. They are already overwhelmed. Without understanding the logic, it becomes very, very difficult for them to follow the entirety of the program. But if I produce evidence in front of them, this is wrong with your child, this is wrong with your child, this is how it should be done, this is how it should, then it gives them a reason to follow it. At least they know they are in the right direction. So this is where, functional medicine is a little different from the other holistic approaches of treatment.
What results can be expected from following functional medicine approach to treat our children?
Right, that's a good question. I think this is what parents are looking for. They have been doing a lot of things for years, and nothing comes out of really significant. But for the last 1.5 years or 2 years, we are very focused on these learning disabilities in from age of 3 to 21. So our experiences, 70 to 80% of the overall improvement, 70 to 80% of the kids, they start showing good improvement in next 2 to 3 weeks of they starting the program. The first thing that happens with them is they have a better digestive system. 90% of these kids have a poor digestive system. They have constipation, they have bloating, they have pain, they have terrible stool issues, huge problem in 90%, and it's not a coincidence. The moment we start working with them, 90% of them, they start getting better. Okay, and in the period of I think 2 months and 2.5 months, largely their digestive health problems are stabilized. Second thing that happens with them, that's again in majority of these kids, is they start getting a better sleep. And sleep is another issue. If the child doesn't get the sleep, they don't regenerate their body. Now, daytime we're all doing a metabolic activity. Night we have to regenerate ourselves. When they don't get sleep, that's a problem. So that's the second thing. Third, hyperactivity start coming down, and we start reducing the amount of drugs they are using for their hyperactivity. Then the speech start getting improved. Some of them, they were non-verbal, and today many of them have become chatterbox. From non-verbal to chatterbox. Some of them were speaking one word, they started speaking multi-word words. Some of them were not making sense out of their words, they have started making sense. So I think speech is another area which parents are worried about. But speech is a later stage. But of course, in 3 months also, the initial program, we have seen many of the kids start improving their speech. So in a short period of time, we can show parents a good quantifiable outcomes.
Okay. So are the changes going to be permanent or temporary?
Yes, it's a good question again. Okay. So generally, for example, hyperactivity. Conventionally, we give them suppressants. You take the pill, there's less of hyperactivity. But because the root cause is not addressed, it's not a permanent change. But in our case, since we are addressing the root causes, if toxicity is a problem which is causing hyperactivity, if infections are a cause which causing hyperactivity, because we are eliminating these triggers of the problem, so it's a sustainable change. Of course, we have to continue the treatment till the time we make a full recovery. But yes, it's not a temporary or it's not a quick fix. It's a permanent change that happens to the brain.
So, do you advise other therapies while undergoing your treatment?
Right. So we have no expertise on the other therapies. We are largely from functional side, but we see there are two kinds of therapy that is happening for these kids. One is external therapy. That is, we training the mind from external therapies, all OT, speech therapy, there are various of them, and they play a good role. But we work in an internal therapy. That is, we making sure the cell and the mitochondrial function is doing well. And as the cellular function improves, the external therapies becomes much more productive for these kids. So we say if a parent can afford and willing to do it, they should go ahead. But it is important that we make the cellular function better, and those therapies are more useful to them.
How much time will it take to completely come out of the problem or a disease or a disorder?
Right. So again, depending on the severity of where we start from, if a child is younger, I would say 3-4 years of age, 9 months to 12 months, ideally we can say, we can largely fix the problem, or we can make them diagnosis free. Okay, that's a goal. They say it takes 8 to 9 months for the rewiring or regeneration of the brain cells to happen. So that's a period, and this is our practicality also that we see. Some kids, of course, in 3 months, 6 months, parents have started reporting that the child has started going to a normal school, or nobody can now recognize them that the child has a problem. Okay, this is no more a diagnosis tagged along with them. So 6 months, 9 months is a good time, but of course, if the child is 7 to 8 or 10 years, probably they'll take 1.5 years or so. But 3 months and after that they see a constant progress in their health.
That's a great news. So, do you also recommend a GF, SF diet too? How much do you think diet works?
Right, it's a good question. Again, a lot of people, have issues. How do we change the diet? Yes, our body is made of what we eat. Now, if we don't eat ourselves with a healthy food, we cannot be healthy. And of course, genetically modified foods like wheat, dairy, sugars, they have to be eliminated because these are new proteins in these foods, and our immune system keep reacting to them. But what I also realize is on the name of GFCF, that is a gluten-free diet, kids are put on to white rice. Now, white rice is again another negative substitute. One negative food is substituted with another negative food. So basically, we have to substitute one unhealthy food with a positive food. So that's this is where we are very focused on feeding them good quality food. Of course, we go for gluten free and casein free.
Okay. So, what happens if there is an emergency? Do you prescribe medicines too, or do you oppose them completely?
Okay, so we go a step. See, again, the two parts of the thing is one for the treatment, one for the parental education. Now, today we think fever is a bad thing. Okay, a child is having a fever, even it's a viral fever. If they go to a doctor gives them antibiotic. Now, antibiotics have no role to play in a viral infections. Second, antipyretics, when we, even with a mild fever, we use an antibiotic, we don't let the immune system function. This is where some chronic infections are in the body because we never let the immune system go. So we always tell parents, of course, we cannot, push them. We tell them if it is not an emergency, for example, fever is only 100, 101, please don't get into antipyretics as much as possible. Yes, if there's an emergency, you need to have it. Antibiotics, if it is a viral fever, or there's no emergency for you to take antibiotic, please don't take it, because in our experience, child was progressing better, and for some reason they had to go see a doctor, and doctor has given them the antibiotic, and they start the regression. So we have seen a lot of antibiotic damage done in some of these kids. So we always say, if you need we always stay in touch with all these parents, and in case there's more emergency, we say go to homeopath. Homeopath also has very quick remedies for fever and infections and all that. So as much as possible, we want to avoid.
Okay. What is the success rate of functional medicine?
I think even as per the data, they say 80 to 85% of these kids, they have a issue caused by epigenetics, that is factors which are influencing the genes to manifest a disease. Okay, so I believe, and in our experience, 80 to 9% of these kids can be improved, and majority of them we can, our effort is to make them diagnosis free. So I think if a parent is able to do, of course, it's a lot of work. It's not easy for a parent. You have to change the light, you have to change the food, you have to change the water, you have to change Wi-Fi. Lot of things we suggest them, but if parent is willing to do enough hard work, 85 to 90% of these kids can be greatly improved.
Is there any certain age for a child to start with functional medicine?
Not really. So we start with 2.5 or 3. Generally, this is where at least a parent would understand that something is wrong or something is not right in the kid. But yes, we have kids from 18 to 21 also in that range. But yes, earlier a parent would come to us, easier it is for us to sort of turn around things for them. But because by the time, if it's 10 and 14, if it comes, the things have become more, infections are more rigid in those kids, and rewiring of the brain becomes more tricky. But of course, improvement will certainly come, doesn't matter what is the age.
So do we have to follow the functional medicine approach lifelong? Sustainable?
Yes. So there's a question that parents always ask, what is next after 3 months, 6 months, 9 months. So I always tell them, you buy a high quality car, you cannot start putting bad fuel to it. Right? So there is no substitute to the good food. Yes, of course, if we solve this diagnosis or this hyperactivity, this speech problem, It's not that if we bring back the bad food, after 2 years, the problem will come back. Potentially it might not come back, but because body is not able to tolerate those foods, something else will come. So today, apart from these learning disabilities, kids are getting into type 1 diabetes, the kids are getting into hormonal issues, kids are getting into thyroid problems, all sort of problems are coming simply because we are feeding ourselves with all nonsense. So after we fix them, at least 70-80%, if we sustain on a good healthy lifestyle and the food, the rest 25% nonsense, if we even put into our body might be able to tolerate because the environment is good. So this is what we tell. And yes, we don't want any other things also to come in their life. That's also the one of the goal.
Okay. So what are the essential lifestyle modifications functional medicine practitioners asked to follow whole life as a family? As you said, these are like very tough things. What are those recommendations?
Right. So now, when we talk to parents, most of them they always informed us that the child was normal. They were doing them normal, and this pandemic period, a lot of more people or kids have been diagnosed with the problem. Now, what was the scenario in this? A child was home on a mobile phone under a tube light. Now, tube lights, artificial light, blue light toxicity is a major concern today. So, and of course, a EMF that is created by the Wi-Fi and the machine, the electronic device. So this has led to a lot of trouble in kids. So we need to improve the lighting in the house. We cannot keep using this LED blue or white light. We have to change it to more yellow light. That's a simple thing, and it is going to help everybody in the family. Second is what we also every day whenever we talk to a parent, they say a child is always asking for more and more water. And when we look at their reports, we find that they are dehydrated at cellular level. So it's a strange thing. They are drinking more water, but they're still dehydrated. The markers will tell us, right? The moment we change their water, and one simple practice we tell them is to start using sun-charged water. Take a glass bottle, keep it under sun. So changing the water, because body is 80% water. If anything has to happen in the body, the water has to be changed. So the moment we start giving them sun-charged water, the need of the water comes down. So hydration start happening. Then comes the role of the food. First is light, then is the water, third is the food. There we want to eliminate or genetically modified foods, refined foods, and processed foods and sugars. And of course, as a replacement, more positive grains and positive foods. If we do this much, and of course the sunlight, all these kids are low vitamin D, critically low vitamin D levels. So that means they are not exposed to sunlight. So if they do that sustainably as a family, they will save their kid, also their own health. They will not get into diabetes, they'll not get into hypertension, they'll not get into thyroid problems or other infertilities and all that. So this is how the nature has built us. And if we make these 3-4 things right around us, things can be sorted.
Okay. So do other practitioners like allopathy support functional medicine?
I think this is changing now. It takes 20-25 years of time frame for a new research to become a clinical practice. But things now, last 10 years, things are changing at a much rapid pace. But we are seeing a lot of conventional doctors are coming into our sort of a practice now. Okay, so yes, it will be a little friction in the beginning because what we claim is the latest science and the technologies and all that. But as we produce more results, as we produce more evidence, yes, conventional doctors there will be no way for them to rather turn into our way and start helping more kids. So I see that, in fact, 30-35% of our kids, their parents are doctors themselves. So that way, I don't see any issue there. Only the awareness has to increase.
So tell us about basic guidelines to be followed while undergoing functional medicine treatment.
Yes, so I think a parent should have to have a patience and a lot of willing to do it. So this is one other thing that a parent should be at least at the mind level. They should be accepting that they can help their kid. Now, if somebody has told that this parent that their child is autistic, nothing can be done. All you can do a little bit of a management. That management can, help them get through life. Then there's a lot of negativity in the thought process of mother and father. So we put a lot of focus in their head. Please, at least in your head, don't keep bringing this diagnosis. There's a problem, we are solving it. You be very, very positive. So at the energy level, it helps the child and the parent. Second is, of course, 3 months we can produce noticeable improvements, but they have to sustain for a long period of time. It's not that many times we have seen 3 months the child is doing good and parents drops off and start falling what they were falling earlier. So this is where, when they are coming to functional medicine, they need to be with a little long-term strategy. They don't want to drop off after 3 months, 6 months, so that we can help them drop their diagnosis. And of course, they cannot make the changes for the child only. They have to make the changes for the family. That is the mother and the father and the other siblings and all that. So that the child doesn't feel alienated, that I am eating something and these guys are eating something. I'm staying on a different light. These guys are staying on a different light. So I am not using phone. So all of them has to change, because if we don't make those changes, then, it can become a lifelong problem. A lot of, they have to be strong in the mind. And of course, outcomes will ensure that they are sticking to it.
I have heard that we should not use refined oils for our children. So what kind of oil should we use if we are not using refined oils?
Right. So now it is becoming very, very evident that autism or any brain disorder is actually an inflammatory problem, or rather an autoimmune problem. Okay? And refined oils are a big, big problem there. Refined oils are a highly inflammatory food. Now, there's already inflammation, and we are fueling or putting more fuel to the fire by feeding refined oils. So in case of autism, what we do is we ask them to cook into desi ghee or coconut oil. Now, seed oils, for example, sesame oil or other seed oils, they are good for a healthy person. But if a person has already inflammation in case of autism, because they have higher content of omega-6, and then there's a disrupted omega-6 to 3 ratio. So we say coconut oil or desi ghee, Bellona method desi ghee. So that is what we should be using for these kids till the time their inflammation has come down.
You also mentioned that we should go on a gluten-free and a dairy-free diet. So if we are not giving traditional milk to the child, then what is the alternative?
Right. So plenty of alternates. If you look at it, at least in India, there's no dearth of alternates for us. Now, in case of white rice, we can replace it with brown rice, red rice, black rice. And in Tamil Nadu, we have a lot of traditional varieties of very, very low glycemic index rice. Then we have these 5 positive millets: little, kodo, barnyard, foxtail, brown top. Extremely positive millets. Now, one thing is, of course, a carb from the grain. Another thing is a fiber that we get from the grain. Now, if we are eating refined foods or white rice instead of for a gluten-free diet, we don't feed these microbes. Now, this gut microbiota is one organ which is keeping our body healthy. To increase the quantity and the diversity of this microbiota, we have to eat a lot of diverse fibers. So these millets, little, kodo, barnyard, foxtail, brown top, they have very, very different, each grain have a different fiber. So we tell them every alternate day, you take another grain, another grain, another grain, another grain, and keep repeating them. So as we keep feeding different fibers, their good bacteria will growing, and their infection control will happen. And of course, these are low glycemic index foods. Many of these kids, they have a metabolic disorder. That is, their mitochondria is not processing the sugars well. And then when we put them on low glycemic index grains like millets, that also helps them big time.
So, as per functional medicine, what are the possible root causes behind autism and ADHD and other learning disabilities?
Yes, it's a good question. So I said non-native electromagnetic field that can come from the Wi-Fi, that can come from cellular network, that can come from the mobile phone, that can come from the tube light LED lights also. Major disruptor today. Okay, and there's enough evidence. Even parents who have experienced this pandemic, they can correlate. The child was inside, and problem either there was no problem, it became a problem, or problem became more severe by staying inside. Second is a dehydration, quality of the water. So drinking enough is not enough anymore. The water has to be structured. It cannot be dead water. For example, if we are drinking bottled water, it's a dead water. It doesn't have any energy. So quality of the water is extremely important. And RO water that we all are drinking is acidic in nature. When it is acidic in nature, it becomes a electron stealer, more oxidizer. So we need to have a water which is running, which has electrons into it, which becomes more of a donator of electrons. So structured water, or sun charged water in simple terms, or there are other better ways of ionized water, Kangen water. So that's a second priority. Hydration is must, and drinking enough water is not enough. Third thing, of course, we need to cut down all the negative foods, that is wheat, dairy, sugar, refined oils, packaged food. In fact, a lot of infections like fungus and all that is another problem. So we even cut down their fruits. Many of these kids, they like sweet fruit juices. A parent thinks I'm feeding them a fruit juice and it should be good, but a lot of parents tell them I'm doing healthy, but after orange juice, he's more hyper or she's more hyperactive because the fungus is fed onto the juice. So that's another part of the food. Third comes the role of the infections. Major part of trouble. All the time we test them, we find fungus or Clostridia. Of course, at least these two things we test all the time. Of course, we, as the technology would proceed, we might find new species which are pathogenic in nature, but Clostridia and fungus. And the moment we start them with antifungals or anti-Clostridia, depending on what is there, depending on the signs and symptoms, hyperactivity start reducing, speech start improving, because their brain is hijacked with these chemicals. Then comes a lot of proteins. Most of these kids who have a low speech or poor speech, they have low proteins. Serum creatinine is low. So basically, serum creatinine, when it is high, we say it's a kidney problem. But when it is low, we don't even bother about it. Okay. So today, enough data to say serum creatinine low and there's a speech problem. The moment we start feeding them enough proteins in the form of protein powder or good foods, they start improving in their speech. Okay. Then of course, B complex. We don't only should focus on B12, the complete complex is required. Magnesium is another deficiency. Good fatty acid is another deficiency. A lot of deficiency these kids have the moment we precisely start feeding them, not randomly. Now, what is happening? Sometimes we randomly give B12. High dose of B12 can make them hyperactive, but we have to sort of precisely do these things. Then comes the role of their liver function. Liver is one of the detoxifying agent. And most of the time we see in the kids, their enzymes are high. Imagine that the liver in such a young age is taking a toll. That means it's not able to process the toxin. So improving liver function is now one. Then heavy metal toxicities. Mercury is a big one. Lead is another big one. Aluminium. Many of the vaccines have aluminium. Our parent wouldn't know, but it has, and high levels of magnesium we always find. We first test on the serum, then also we run a hair sample to sort of to confirm it. And aluminium is another big problem, and most of us are cooking into aluminium vessels. So these put together, infections, food, lighting, dehydration, deficiencies make the brain not to function well. And step by step, we have to sort of eliminate these issues to make them better.
What tests do you recommend for the diagnosis of the root cause analysis?
Yes. So in India, at least what we have done is we start with a blood work and an oats test. In the blood work, we do almost 140 parameters where we look at 22 elements. In that, lot of heavy metals are there. Selenium is another one, which is important for thyroid function. And in these kids, thyroid function is compromised many a time. Okay. So we look at these elements, we look at their nutrition, B complex, vitamin D, magnesium, zinc, copper zinc ratio. Copper is always high in many of these kids, either because of the zinc low or because of their water filters have copper into it. So copper toxicity is another problem that is happening in society. So we then look at their organ functions, thyroid function, liver function, kidney function, their lipid profile. Then we look at the CBC. CBC, we always find the lymphocytes are high, neutrophils are low. So that means some level of chronic infection is there. So a lot of blood markers are there and some autoimmune markers also. We look at ANA, NTCCP, and these guys also in young kids are there, not beyond the range, but they're high where it should not be. That means autoimmunity is building up. Then we also look at their organic acid testing. We mostly do this test in India because it becomes much more affordable if we do it. And of course, we can repeat at a frequency. So in oats test, we again look at the metabolism, we look at their amino acids, we look at their infections in the gut, if any gut permeability is there, or fungus or Clostridia. So a lot of good information we drive. And in case heavy metals are high in the blood, then we ask for a hair sample so that we can confirm and do more things for the detoxification.
Okay. So you just mentioned about fungal, right? So can fungal or other gut infection be a major concern today?
Major problem. See, now let's understand this way. The kind of light we are under, kind of microbes we can grow. For example, there's a washroom and there's no sunlight coming, it's dampened washroom. We can see black mold on the walls. Now, not that we have went and sort of, inoculated that. It's simply based on the light that we are under, kind of microbes we grow. Now, fungus likes dampness, fungus like blue light. Sunlight is antibacterial, antifungal, antiviral also. Okay. Now, we are living in a very non-conducive environment. That is, we hardly go outside. We are always in the same environment with the bad lighting. So this is a very conducive environment for us to grow infections. Not that somebody is infecting us, simply be in a bad lighting is one major problem. And of course, today kids are fed with all sugars, all refined foods, all packaged foods. We think we are a wealthy family and we should give the child what they need for their tongue, but we are feeding them a problem, or we feeding them a disease. So major problem. The moment we start controlling their infections, their health start becoming better. Now, if we have good microbes, those microbes will help us to digest the food and make the food as a part of us. Now, if we don't have good microbes, even though we are eating a healthy food, that healthy food cannot be converted into a good source of nutrition for us. Those microbes are playing a good role. So the imbalance or dysbiosis is a major challenge today. So we need to control the infections, improve the good microbes, and we can see the child starts thriving.
So I will come to a different kind of question now. Can C-section increase the risk of a disease?
Yes. So now it is becoming very evident. A child will gather their good microbes from the mother. When a delivery is made through a vaginal canal or a birth canal, child would get those microbes from the mother. Now, when we do, of course, in emergency, we have to do it, but it should not become so much so that every mother is going through for that. And there, when we collect our data from the parents, many of them, they report their child has born through C-section. Of course, probably as we do few thousands of patients, we have more stronger evidence. We can put together, publish a paper that these percent of mothers, but largely these mothers have gone through a C-section where child has got into trouble.
Okay. So why more and more kids are getting diagnosed or getting a severe form of disease?
Yes. So the environment that we have made. So today we have a Wi-Fi, we have a cellular network, we have more 4G, 5Gs coming up. Then we have a satellite network, then TVs and screens, and we made the environment very unhealthy for ourselves. Then we are trying to be very hygienic. Hygiene is okay to an extent, but every time using an antiseptic, every time using an antibiotic, every time using a hand sanitizer, every time just these microbes, it can be health for us, it can be unhealthy for us, right? We cannot be in the overkilling mode. And as a society, and especially if we look at it, these are the problems largely now well-off families. largely where where people are sitting in high-rise buildings today. So another important thing is we should be grounding ourselves. If our infections are part of the problem, and good immune system is required to beat these infections down. Okay. Now, if we are on a ground, we are doing a grounding, we gain more electrons. Those electrons will improve our redox potential. That means better immune system. That means we can control our infections. We are living on a 10th floor, 14th floor, high-rise buildings. We are away from the ground where we should be. We don't get under sunlight. We are always under bad lighting. We don't drink good quality water. All this put together is making a human body conducive for infections and not suitable for health. So that is where more and more kids, and of course, I think I cannot claim about it, and it is not wise for me to speak about it. But when we take the information from a parent, we always hear back that a child was doing well, a child was growing normal, then comes a double vaccine. For example, the parent was in India, they had to move to USA or UK or some other country for some reason, and they were double vaccinated and they had the problem. Before that, there was no issue at all. And then sometimes we'd say, the parent was in a remote village, they had come to the city for some reason, for job and all that. And doctor said, okay, you are now losing time. Let me inject those vaccines in a shorter period of time. Okay. So there are so many things we are doing, which is sort of against nature, and we are putting ourselves and our kids into risk.
How pandemic has led to the worsening of disease?
Yeah. So good immune system needs good light and a connection to the nature. Now, when we say connection to the nature, we get also good microbes from the nature also.
Yes.
Those are making our healthy microbe on the body, in the body. Now, when we are in this, lockdowns inside the house, under poor light, no sunlight, that's a big risk that we are taking. Another thing is we're living in a closed rooms, and in the pandemic, we were also scared. Even the windows were closed. Okay. Along with the oxygen that we transact from the nature, we also get prana. The prana is life force. So that is also sort of in a way restricted. So we restricted so much so that, we became a house for disease for us to come. Of course, now there's enough data also today, at least now it is published, saying that people who are low vitamin D, they got the more severe form of the COVID. And if we have enough vitamin D, that means enough sunlight, that means our immune system is good enough. That means even we get the infection, we wouldn't have gone through such a terrible times. Okay, so we actually went against the nature and we made the things worse for us.
Yeah, true. Yeah, I remember my vitamin D was very low, and I went through a very severe COVID where I just really escaped.
Yes.
Yeah, I can connect. So my next question is screen time linked to speech delay?
Oh, 100%. So again, it's science is also there. So there are two parts of the brain. One is linked to the memory or the speech. One is linked to the memory from the screens, the visuals that we see. So if the child is always on the screen, he will be more into visuals or more into the memory. He's a sharp guy. There's no problem with these guys. The only thing is an imbalance. He have retained more memory, but he has not developed the speech. And the moment we keep the screens away, they start developing their speech.
Can you repeat it, because we lost you in between?
So there are two parts of the brain. One is dealing with the speech. One is dealing with the memory. So the child is on the screen all the time, remembering these cartoons and chota beams and all that. So they are gathering a lot of data in the form of memory, but they don't focus on their speach. Balance. The moment we put their screens away, they start learning that skill which they have not learned. So certainly, there's no doubt in my mind that screens are making these kids not to speak. Okay, the moment we put these screens, and we should be doing it apart from anything else, just people are not communicating to each other if we are always on the screens. Parent is not communicating to the child, child is not communicating to the parent because we are busy with our own screens. So one is, of course, the disease that is coming with it. Of course, the then social system is disrupted.
Right. Now, ask question about heavy metals. I've heard a lot about heavy metals too. So heavy metal toxicity coming from vaccines, does it trigger the problem?
So aluminium certainly is a big issue. Most of these kids, when we look at their, either it is in the higher in the range, or it is in the toxic range. Okay. So, and it is not a coincidence that this child has the problem and their aluminium levels are high. So the problem is when we do this data research and all that, we want to pinpoint every problem to the one source. But these problems are always a multifactorial problems. So vaccines brings two issues. One, of course, heavy metals as the form of aluminium. The other one is the immune reaction. Now, now we are considering these as autoimmune problems. Autism as a autoimmune problem. Okay, and vaccines are known to trigger autoimmune reaction. Okay, so I think if we look in the generic sense and we put and try to make sense of the data, we can certainly make sense. Lot of information we can gather. So I'm not saying I'm not against vaccines, but we have to be careful. We cannot just, for example, COVID. There's no data to say that COVID has impacted kids. Largely kids were, because their innate immune system is largely good, but still we going on to the path. So we have to be careful. That's what I would say to parents.
When we're talking about vaccines, and it's a debate always, can vaccines be the cause of autism or ADHD?
Right. I wouldn't say, see, these kids are predisposed to a problem. They have predisposition to a problem. Then they might not be eating well. They might not have a good microbes. They might not be staying in this thing. So they already in a tipping point. And one trigger can lead to the diagnosis. So that way, so I would not directly put blame onto one or another thing, but it's a combination of things. If we take care of this in entirety, doesn't matter if the problem has come, at least we can solve it. But probably we need to have more right minds to working on to the correlation and giving us parents a right direction, what kind of vaccines and not doing and doing. But at least some data is there to correlate, but at least in my capability, I cannot be so precise.
Okay. I have also seen parents giving, say, 60, 70 supplements a day to a child. So my very genuine curiosity is, are so many supplements safe to give to kids?
Right. So we cannot replace pharmaceutical drugs with a bunch of supplements. Okay. And supplementation should be done more precisely. Right. And it has to be done gradually. A 3 or 4-year-old child on 50 different supplements, the body cannot handle. Then even it's a good thing, it is turning out to be a bad thing. Right? So start with the basics, be complex. Very important. Proteins, extremely important. Good omega-3, extremely important. Magnesium, zinc. Of course, even if magnesium is not required, I wouldn't supplement. If it is less only, then only I would give. Probiotics, we have to have a right choice of probiotic. We cannot randomly give any probiotic. So that way, yes, I also give supplements, but not to the extent that a child is overwhelmed and body cannot handle and they get into more problems. So we have to be step by step as they're improving and able to handle those. See, if I do a lot of detox just like that, the body gets into a lot of trouble. A lot of time we see a lot of detox reaction happening into these kids because of the infections, because of heavy metals. So we have to go slow.
You also mentioned about RO water. So I will ask something about that also. Of course, we all use RO water now. So So is this also linked to rising cases of autism in the society?
Right. So RO water is acidic in nature. If you check the pH, it will be less than 7. That means it has become electron stealer. So our
Yeah, you
autism is a
mentioned it,
mitochondrial.
right?
It's a mitochondrial problem. That mitochondrial job is to use the food and convert into electrons and then ATP. It needs a lot of electrons. Okay. Good quality water should be giving us
Okay.
electrons. Now, we
Yes.
drinking our water has become a stealer for us. It is taking our electrons away, and definitely it is adding to disease. And in case of child where autism is there, by improving the water, we can improve their problem. That means this was a negative water was one of the contributor there.
Mhm. I hear a lot about mitochondria and mitochondrial function and mitochondrial dysfunction. Can you briefly explain us about mitochondria? I mean, function of mitochondria in our bodies to maintain health.
Right. So
Very briefly, like of course in a layman's terms, so that
yeah,
our
there
audience
is,
can
if
understand.
we simply put it, it's the engine of the body. Okay. And every cell has 500 to 15,000 or maybe more than that mitochondria. Each cell has 500 to 15,000, and nervous system and heart cells has the highest number of the mitochondria. Okay. So this is converting the food into ATP. Child has hypotonia. Child is lazy. Child cannot do its gross and fine motors. That means he's not able to produce enough energy because mitochondria is impaired. Okay. And the moment we start improving the mitochondria, the conversion of the food into the ATP starts happening and they start developing the muscle and all that. Okay. So mitochondria is a key to the, and all the function, whatever the function is there in the body, mitochondria is playing a role there. So it's a fundamental unit of this thing. There's an engine. And if we improve the engine by ensuring that engine has good fuel, good raw materials, whatever it needs for its own production, for its own replication, and for its own metabolism, if we do that, the complete body will function better.
You just told that one of the reason mitochondrial health gets disrupted is RO water.
Yes.
And I think you also mentioned about blue light toxicity. So I will ask a very specific question now about that. So is there any connection of blue light toxicity to autism?
Absolutely. So blue light is known to disrupt the mitochondrial function.
Oh, okay.
So let's understand, diabetes is a metabolic problem. Okay. And a lot of people are being diagnosed and nobody's given answer. We only thinking that food is the reason. Sometimes changing the food doesn't also help because we are sitting in the blue light. Blue light is one of the major reasons which is disrupting the metabolism, that is disrupting the mitochondrial function, that is causing insulin resistance, that is causing high blood sugars. So, and if mitochondria is not functioning well, doesn't matter. And brain cell has the highest number. Also, if that engine in the brain is not working well, whatever name of the problem we call it, whatever that symptom might come out of that. But blue light is certainly a major problem, which is disrupting the mitochondria. Now, when we go under sunlight is good for the mitochondria. Earthing is good for the mitochondria. The moment we change that scenario, they start doing better, the symptoms start improving. So we all the time see, child was not sleeping, the mother was giving this and that, all sort of things were given to it, pharmaceuticals given to. The moment we put them under sunlight, the moment we reduce the tube lights, the sleep comes. So sometimes solutions are so simple, but
Yes.
we have complicated so much so that we don't have an answer to the issue.
Yeah, I'm just thinking, I mean, small changes might really lead to better health of our children.
Absolutely.
So here, my intention is not to find a fix for autism, but the biological troubles or infections and pains our children are going through.
Yes.
By bringing these small changes, it really helped them so much. So you also mentioned about grounding a bit. So now can you explain me a little bit about grounding and how it helps?
Right. So we humans are supposed to be on the land. Okay. connection to the land is critical for us. It has an electromagnetic field, which is healthy for us. Our mitochondria is vibrating at a certain frequency, and the electromagnetic field from the earth is also vibrating at a certain frequency. And there's a match. And when we are in a conducive match, our body functions better. We gain more electrons by doing earth. We connecting to the earth, we get extra free energy basically. But it's good for the mitochondria. The moment we are under Wi-Fi, we under tube lights, we are under cellular networks, there's a lot of positive ions that are put onto us. And when we go do a grounding, to an extent, we can neutralize whatever negative side effects done by this man-made technologies. Okay, so grounding becomes a very, very crucial part of the healing. Now, I always say go under sunlight and on the ground. And of course, we have these grounding mats available. A lot of things in that direction are happening, at least in the science, technology space also, which can keep us grounded even while we are onto any other floor that we are. So that way, it's extremely important. Good light and the grounding, my most priority, and it is working.
So, Dr. Ashwani, when a child is diagnosed with autism, it's very natural for parents to have a fear to go for a second child. That they also might not be diagnosed with autism. In that case, what tips can you give as a functional medicine practitioner for a woman who wants to conceive?
Right, so it's a very, very genuine fear a mother or a parent would have. But if we look at a little deeply, 80-90% of the problems in kids or otherwise as a society, the chronic problems that we are dealing with, they're not genetic in nature. They are simply epigenetics. We are not keeping under good light, good water, good food, or good microbes has led to the problem. So if one child has the problem, doesn't mean the new child will have the problem. And I think that should not be a restriction for them to get into another pregnancy. Yes, they need to become more careful that even during pregnancy. See, another thing that is happening today is for who we want to have a child. A mother's body has to be healthy to give a healthy child. Okay, now if she's on hormones, her body was not suitable enough, but we have tried all sort of methods. Somehow we get that pregnancy done. If body, because mother is giving a life, and if mother's body is not healthy, it cannot give a healthy baby. So make sure your body is healthy. And second, don't worry about if one child has a problem. You can still amend your ways. Make sure that you yourself is healthy so that you get to a better child. Okay. So sometimes, we just in the race, we want to have a child, we want to have a child, but we don't take care of how well my body is. Right. So I think another thing that is still happening is a folic acid. In pregnancy, mothers are asked to take folic acid. Folic acid is synthetic B9, very dangerous. And one reason behind a child might be autistic. So folic acid should be replaced by folate or methylfolate. Largely doctors have replaced their strategy, but there's still doctors which are prescribing to this folic acid. I think that should also be very, very concerning, and mothers should become aware. See, we cannot put our health into somebody else's hand all the time. We as a society, also as a family, also as a mother, we have to become conscious and aware, and we have to learn what is right and wrong, so that if once trouble has come, we can always, the 90 to 95% chances we will not get into again if we are careful about it.
Mention about folic acid, but folic acid is prescribed for a reason. Everywhere in India it is prescribed. So
folic acid is a synthetic hormone. Sorry,
what function does it serve? Why is it prescribed to pregnant women?
Why is it? So it is required. So B9, B12 for methylation purpose are very, very important. Now, only bad thing that we are doing is we are not prescribing the right quality one. In fact, what we are prescribing is dangerous. Okay, so if it is folic acid that is given, which is synthetic, rather if we switch to folate, which is more natural, then the problem would not come. Rather, it will be a better pregnancy.
So, like you mentioned the precautions to be taken. So if you can just list out very important precautions a pregnant lady should take to prevent the child from getting neurodevelopmental disorders, that will be
Right.
great for our audience to know.
Right. So first of all, a mother has to be in a right balance. Her health has to be good. That is, she should not be eating a lot of sugars or refined oil, because she is making her body as a giving her body to the child. So her body has to be healthy, and that has to happen, she has to have all the raw materials. So please cut down your sugars, please cut down your wheat, dairy, refined oils, basic. Now a child gets the bacteria, the microbiome from the mother. Now if mother has infections or fungal infection crossed to the child, will get the same. So she needs to improve that her digestive health is good. And most of the time, mothers has a bad digestive health because of there's a pregnancy, there's a lot of load, and there's less mobility and all that. So she need to see. Digestive health can tell you what kind of microbiota health is there. So if there's a problem, there's acidity, there's a GERD, there's constipation, there's a bloating, gas, all that. That means mother microbiome is not healthy, and that's the same microbiome a child is going to get. So she need to work upon that. So she need to eat more healthy foods. She cannot feed with the negative foods. No outside food. I mean, sometimes they have this cravings for chatpatas and all that, but they have to be careful. They use imli or they use some acidic thingy to make it khatta. Then making sure that whatever raw materials that we use at home, instead of refined oils, we're using coconut oil or desi ghee to make anything which is, even we have to fry, we have to use the right sources. The problem, ensuring that content of that product is good, so that finally a mother is getting right nutrition for her body and ultimately for the child. And I see they put their laptops into their lap, and the child is in them, and they're using the laptop by keeping them. That's a very, very dangerous strategy. Okay, mother should be sleeping at time when she's pregnant. Okay. Basics. I mean, the basic applies to all of us, and basic applies to the mother also. And if she does that, I am certain that this, at least, see, today this prevalence of the problem is rampantly growing. So if a mother becomes more conscious, then at least the growth of this prevalence of more and more kids are being diagnosed will come down. And of course, we can eliminate to a greater extent if we are more careful about it.
I do agree. And so, yeah, I would like to sum it up with like healthy living for parents, for a family is also equally important as healthy living for our children. So if we take a lot of precautions right from the pregnancy itself, and eat healthy, don't take synthetic stuff, don't take synthetic supplements, use charged water, don't use a lot of fluorescent light, but yellow light, and go out, ground ourselves, use vitamin D, get vitamin D from the natural sunlight. So these are some of the ways to improve our lifestyle to get a healthy child also.
Absolutely.
You really answered, yeah. Yes. So you really answered so many questions, and it was a long conversation. And we have come to the end of our conversation. On the behalf of PlayStreet team, I would like to thank you again, Dr. Ashwani, for your valuable time and for sharing the knowledge with us. I hope all the viewers are really able to understand that about 90% of the children diagnosed with ASD are non-syndromic cases, which means there are mostly epigenetic factors contributing to the disease. Good news is that we can change epigenetic triggers and improve a child's health. We understand that working at a body level by improving gut function, metabolic health, removing chronic infections, and heavy metal toxins will improve overall health, thereby improvement in the brain health. Thank you everyone for joining us today. Take care and goodbye.
Thank you.